Hi, my name is James Sutton. This is Road to Recovery. I'm a person in long-term recovery, and my guest today is Laurie Mombay. Welcome, Laurie.
Thank you, James. I'm glad to be here.
And Laurie works with me at the MCCF, Montgomery County Correctional Facility, located in Boyds, Maryland. Laurie, can you tell us a little bit about yourself?
Sure. So I've been working for Montgomery County for 20 years, and I've been at the jail for the last 12 years. I started out as a victim advocate with the police department and then moved here to the jail to be a therapist and have been the supervisor of the mental health unit since 2019.
Okay, great. How did you get into that field of victims advocate and being a therapist for mental health therapist, right?
Yes. I've been a therapist for more than 20 years. So my undergraduate degree was in something else entirely. And honestly, without sounding too dramatic, I entered mental health as a calling. I'm a person of faith, and I felt like this was what God was calling me to do. I ended up in corrections kind of by a series of accidents and unfortunate events that turned out to be a good thing, through various, having jobs in places where there were cuts and cutbacks. That's more or less how I ended up in corrections. My position was cut during the years after the recession, and I needed another position, and I went looking, and there was an opening at the jail for a therapist. I never would have thought that this is where I would end up, but this is where I'm currently living out my calling.
Right. And you do a fantastic job. Now, can you tell us a little bit what your team does? Because, I told Laurie when I first spoke to her about being on the show that her team is unsung heroes. Nobody really knows. I mean, you guys are like on the front lines, really, and nobody really knows the work, the hard work, and the really important work that you do.
Thank you for saying that, James. So I supervise a team of, should be a team of 6. I have one vacancy. So I have 5 therapists that work with me. And I don't say work for me, they work with me. We work together. We have a tough job. We manage or provide for the mental health needs of inmates in the jail. So we have 3 mental health units. We have a male unit that can hold up to 40. We usually have around 32 to 35 inmates in the unit. It's almost always full. We have a female unit. The space can actually hold 14. Right now we have 21 females who are mentally ill. So they're spread out in other places. And then we have a step down unit where we have about 20 males. We provide assessments and manage behavior, provide behavior plans and treatment plans for the inmates in mental health housing. And we also provide mental health services on an as needed basis to the inmates in the general population. So it's a very, very busy environment. And a lot of our people are really, really ill.
Right. And that's something that I was thinking. I read about. There was a warden in Cook County Jail years ago, and I was really impressed because she was a clinical psychologist, right? Tapia. And I was reading an article about her, and it was saying in Cook County, their count was almost 6,000, and they were saying about a third of them have mental health diagnosis. And that's a lot. And what would you say our population looks like here in Montgomery County?
So I had heard that 30% population count, that 30% of inmates in jail are mentally ill. And so I wanted to kind of get an idea of what that number looks like, because it kind of felt to me like it was bigger. And so a few weeks ago, actually, I took one of our locators, a printout of everybody who's in jail. And, we have about 700 to 800 inmates, I think is what our average daily population is up to now.
1,000 today.
1,000. Okay, well, that counts everybody in, even people who are at the
PRC
hospital
too,
and things
yeah.
like that. Um, so anyway, I went through page by page and I counted up everybody who's on psychiatric meds, everybody who's currently housed in a mental health unit, and then people on there that I personally knew to have mental health issues who maybe weren't medicated. So it's probably an undercount, right? Because I don't know every single inmate in the jail. It
Right.
was 47% of our population.
47. Oh my
Yeah.
goodness.
And I think that's probably more accurate. And I didn't really even account for substance use diagnoses, which, as you
Mhm.
know, most of our people, there's a high percentage of people with a substance use disorder diagnosis,
Right.
and many who are dual diagnosis, meaning they have mental health issues and substance use issues. So that's probably an undercount. It's a lot of our population. And if we were to look, I think particularly at the female population, um, it would be most of the females, if not all the females.
Right. And that's true. And in the program where I work, jail addiction services, almost every female has had trauma, some form
Yes.
of trauma, which is impacting, is driving their use of substances, self-harm, and a lot of the stress that they're under. A lot of it is trauma. And then a lot of people during COVID got trauma just from the isolation and just the fear that they may die from something that's unexpected and no control over. So under the last 3 years, have you seen have you seen any effect of the COVID on our population?
Yeah. So as you know, we had to shut down a lot of things here in the jail when COVID hit. So we, had to limit the amount of time that people were out of their cell and limit the number of people that they could be out with. So couldn't have large groups. A lot of programs shut down. We had to shut down outside programs. So we used to have a lot of religious programs and other people that came into the jail to provide
Right.
services and opportunities for inmates to do things. Um, and also for a period of time, shut down visiting. So what we've seen, and I don't have hard numbers. Well, I do kind of have hard numbers, but the number of people that we provided services to increased by like 30% over the last 4 or 5 years, just
Okay.
overall. But what we've been seeing is a lot more demand for services from inmates in the general population who are having problems with anxiety, insomnia, just not coping well. And I think part of that is because they just didn't have those adjunct things that used to help them and also just give them ways to spend their time.
Hmm. Right. Right. Yeah, that's what I was thinking too. Just the fact that now we're beginning to, uh, get a breath of fresh air in the sense that we're starting to have movement, which is going to relieve a lot of stress. Just to get out of your cell and exercise or just talk to another human being is some relief that they weren't getting for so long. That isolation and not talking to another human, being able to have human contact, I think, brings down that anxiety and
Right.
stress.
Right. I think a lot of people too, their capacity for resilience, all of us, myself included, the pandemic really stretched us in terms of our capacity for resilience, for being able to bounce back from stressful conditions because we're under that stress for so long and had limitations put on our social encounters and support systems. That a lot of people came through this, if they were just coping, kind of pushed them over the edge. I have a small private practice, and there's such a high demand for therapists even in the community,
Sure.
for people who are suffering. The other thing that we saw during the pandemic, James, is for a little while, only for a few short months, we saw a drop in the population, and so there was a drop in the population in the mental health units. but we have more than recovered from that. That didn't last for very long. And lately it's been shooting up. We're full every single day. We're moving people to make room for new people coming in.
Yeah, I definitely see that in the women's unit, because the women's unit has really spilled over into my unit. And it, I've seen more mental health than substance use, even though the numbers, say that there's been more, drinking, and because people are isolated, it's been more domestic abuse and a lot more, like you said, less services available. So a lot more isolation and people using in their homes, which, exasperates their ability to recover, because they're not really connecting with other people in recovery. They're just using alone, which is just going to be no check, no ceiling. They're just going to not know when to stop, unfortunately. So, and now that we have the units starting to operate again, the jazz units starting to operate again, hopefully we'll see some progress in terms of, coping skills, being able to give more of the population in the jail some coping skills. So when they leave, they'll be able to, bring down their problems a little bit. And let me ask you this, and also in that article I was reading about Chicago, the sheriff was saying that he was saying there was 10 times more people with mental health disorders in his jail than in state institutions. Now, the institutions that we use, what do we use? Springfield, what do we use?
So years ago, the state went to a centralized admissions process. So it used to be that our inmates would go to Springfield Hospital Center, but now they go all over the state. So Springfield, Spring Grove, they go over to the Eastern Shore, Western Maryland to the Finance Center. So they're all over the place.
How's that system working?
They're stretched like everybody else. So
Okay.
There are not sufficient beds for the forensic patients. So we have, a number of people who have been found not competent to stand trial, who are awaiting transfer to a state hospital, and there just aren't beds. So right now that number is over 30. It's between 30 and 35 inmates that were, ordered to the hospital for competency restoration, who are just sitting in jail waiting.
Oh, wow. And so what's the average wait nowadays?
So it has been as much as 2 months.
Okay.
And by state law, they're supposed to go within 10 state business days. I don't necessarily think the state is trying to flout the law. They just don't have the beds. And it's not just a physical bed. They have to have staff to support the patient in the bed.
Right.
And like everybody else, they have been challenged to keep staffing levels where they need to be able to put people in those beds.
Right.
So they're sitting here for quite some time. It's disheartening. I mean, we try to do the best we can to provide treatment for people. We offer medication and therapy and encourage compliance with treatment, but there's only so much that we can do.
Right. And we're going to break in a minute, but I want to come back and explore that a little bit more about the state and maybe what we can do better. And some of the lessons we've learned from, shutting down a lot of the state hospitals, and then the population went to the shelter, and to the jail.
Right.
Yeah. So this is Road to Recovery. We're going to take a little break right now. We'll be right back with Laurie Mombay.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
It's cheap, it's potent, and it's profitable. Really just all about the money.
I'm James Sutton. We're back with Road to Recovery. My guest today, Laurie Mombay. So Laurie, we were just talking about your warm handoff from the jail to some of the state system hospitals. So you were saying there's a 2-month wait right now, and you said that, just like all across America, there's a shortage of nurses, of therapists, of counselors. Those professions have really taken a hit. Now, is it because you think it's because people are doing more virtual instead of face to face? Professionally, are we doing more virtual rather than going in?
I'm not really sure. I think that may be some of it, that people, I mean, I know nursing, I think, is a different thing, right? A lot of nurses just got burned out and maybe they're leaving, they're retiring. Therapists, they certainly, have a lot of opportunities to do virtual therapy, and people got used to, like in every industry, they got used to working from home, right? And,
Yeah.
who wants to come and work in a psychiatric hospital where you might get assaulted, or, work in a jail where you have somebody cussing you out every day.
Yeah.
It's maybe not appealing for some people. So I'm not sure. I think there probably been a lot of things that have led to staff shortages, and it's not just therapists; it's all the support staff that has to be there to provide care. And these are hard people. These are hard patients to take care of.
I
Many
know.
of the people in the mental health unit, they don't accept that they have a mental illness. They refuse medication. They, have some acting out behaviors, some antisocial behaviors. They're difficult to treat.
Right.
They're not going to, always appreciate your efforts or thank you or show even signs of improvement. And that can be hard as a professional. You entered this field to help people, and then you don't see them getting better. And that can be, it can be a very stressful, and it is a very stressful environment.
Right. Right. And because I work on the addiction side, how that's a real complex situation when you have someone with severe mental health and then they're treating their mental health rather than with the prescription that you gave them. They're treating it with a substance, which really complicates the whole thing. So how do you guys unravel that dilemma?
It's difficult. When I first started, I used to ask people, well, do you use, drugs and alcohol? Now I ask how much, because my assumption is that they are using. And it's, changing their mindset about it. First of all, accepting that they have an illness, accepting that it needs treatment, accepting that it's lifelong, and that treatment does not include, smoking weed or using opiates, that's not treatment for mental health issues. Honestly, James, I think that if we keep, go back, if we were to really work on treating trauma, we
Mhm.
probably, even in children, in adolescents, if we had a better system to support children who've experienced trauma, who've been exposed to trauma, we would probably see less of these problems further on, because a lot of people begin using as a response to some traumatic experience. And I think I've said to other people, I think if we really cared about crime and reducing crime, we would get better as a society at treating trauma, because that's where a lot of it stems from. Not to say that people don't have personal responsibility, because they do, but when you look at people's histories like I do, you can see how jail would be in their future based on the
Right.
experiences that they had.
Right. Yeah, I agree. I definitely agree. And unfortunately, prevention is like we focus on prevention about this much. It's always putting out the fire. It's never preventing the fire, right? Unfortunately,
Right.
from listening to you today, somebody will hear you, right? And we'll start working on some prevention rather than letting the problem culminate. So for people that have mental health issues or family members, what should they do in the community? What's available in the community that are good supports? And ask,
Right. So in Montgomery County, we have the crisis center. They have mobile crisis teams that can come out. They're a very good resource. The county HHS has, I'm not part of HHS, but I am aware that they have any number of services for people with mental health issues and, who may have housing issues, all of that sort of thing. Another great organization is NAMI, the National Alliance for the Mentally Ill. Every Mind, the Mental Health Association, formerly known as the Mental Health Association of Montgomery County. All these community organizations. I talk to a lot of parents whose adult children are in jail who are seriously mentally ill, and my heart breaks for them as a parent. I really feel for them, and I frequently refer them to some of these community groups where they can get support, where they can understand more about mental illness and learn how to help their loved ones.
Right, right. Very good. Yeah, those are great resources. And let me ask you this, because we didn't touch on this. With addiction and mental health, how do you think the stigma impacts the client?
I think I see this both with mental health, right, and substance use. There's a tendency to there's a lot of shame around it, right? And I think there's less stigma around mental health, perhaps, than there used to be. As
good.
as society, I mean, just looking at parity laws, right? That they said, okay, we are going to cover mental health just like we cover physical health for insurance purposes. Just
Right.
that alone is saying this is important.
Yes.
And it's a real thing. It's not a character flaw. It's not a choice. It's not somebody's fault. It's a disease just like diabetes or hypertension that requires treatment.
Right.
That's the message that we try to tell our clients. I think the hard thing for a lot of people with mental health issues is to realize that it may be a lifelong problem, that you can't muscle through it, you can't outsmart it. It's a function of how your brain operates. Probably many things that we don't understand still about why people suffer from mental illness, but it's something that requires treatment, and that treatment is typically long-term.
Right. And, that's something that I've noticed too with the mental health population, is that a lot of times when they're doing better, and addiction too, a lot of times when they're doing better, they feel that they're cured. And then they stop doing whatever works to make them be in a stable condition in the first place, right? Unfortunately, with addiction and mental health, and then they may have a relapse and come back to the jail.
Right. And giving people, finding treatment that gives you tools to be able to deal with hard things, because life is full of hard things, and nobody gets around that. And using a substance to cope with hard things is never going to be a long-term solution. It's just going to lead to other problems.
Right, right. So Laurie, I'm involved in a lot of peer work. I train recovery coaches for the addiction community, and I've gone on our own and actually participated in their peer groups to deal with the mental health community also. How do you think peers could be a factor in serving the mental health community?
James, I have never really thought about, because of the environment that we work in, right? Having a mental health peer here.
Yeah, peer specialist. Yeah.
A peer specialist, but I actually think it's a great idea. I recently, I put together two moms who both have sons in the jail who have mental health issues that were both hospital bound. And it got me thinking about what are some other resources that we could bring in, because I'd love to see, a family support group that I could refer people directly to. People who are local, who understand the local system, peer groups that understand what it is to navigate some of the difficulties that our clients face. That's something that we have not explored that I think is a great idea.
Right. Because On Our Own is a peer group. It's pretty well established statewide, and you could say NAMI is too. And I've seen a lot of people who are very functional and have mental health disorders that have really participated in both of those groups, statewide. And, now that you mention it, I've seen, they have a few family groups for addiction, but I haven't seen, do they have family groups for mental health?
I believe that they do. And I think that sometimes it's just about people getting education about
Okay.
mental health disorders, but I would really like to see a robust family group that, we could use as a referral source. Because I think, when I talk to these parents, and it's always the moms, because, mom is the last one that still loves you, even when you've, burned your bridges with everybody else.
Yeah.
And, I feel like the parents often feel like they're they're isolated, that they are alone, that they're the only one that have a child that is like this. And when they find out that they're not alone, because I know they're not alone, because I talk to, 10 or 12 of them every week. They're all going through a similar thing with their kids. I think there's strength in that.
Oh, yeah,
It's
definitely,
not
definitely.
just sharing information, but sharing support.
Definitely. I mean, because just like you said, it's a lifelong challenge for the person that has the mental health, and then all the family members, it's a lifelong challenge for them too. And then it can wear you out, just like caring for the chronic ill, it can wear you out. You need to, get recharged by, some other people that have compassion and have had, similar lived experiences that can, recharge your batteries,
Right. And let you know that you're making the right decision, or, help
Share
you
their
with
experience.
setting boundaries and all
Right.
of those
Yeah,
things that are
exactly.
hard
Share
to
their
do.
experience, right? Setting boundaries, letting them know, in the addiction community, they say, you didn't cause it, and you can't cure it. So they have the 3 C's in the addiction family group that helps them understand and not blame themselves,
Right.
which I think is important. So we're going to be coming to pretty much to the end in a couple of minutes. Is there anything that we didn't touch on that you feel that you might want to share with the public? Is there anything else that we can do to make your job easy? What's your wish list?
My wish list: more staff, more space, more ability to get people to accept the treatment that they need. They would
Oh, I
do
know.
better off if we could just get them to take some medication.
Yeah.
These are hard problems to solve, but yeah. And honestly too, things that we can give them, there's not a lot that we can give them. So I'm always happy when we get, socks and underwear and hygiene items and things like that.
Oh, is that right?
It's
Oh,
important
okay.
stuff. So we get some of that, but just being able to provide for people's pragmatic needs is sometimes the little that we can do for them. It's short
Wow.
of building housing and supports in the
Housing.
community.
Right. And I would think housing, because, there's a lot of recovery housing for addiction, but very limited for mental health and hardly none for severe mental health, So I think that we as a community can do better in providing housing, some housing options for, the mental health community and the severe especially.
Yes, there are people that we no longer see who used to come in here all the time because they've gotten into a housing program and that has successfully housed them. And so they're not in the community offending anymore.
Right. There you go.
The big piece of it.
There you go. So there you go. That's some of the, pieces in the solution, right? So thank you so much, Laurie. This is James Sutton. My guest today was Laurie Mombay, and I'll see you on the road to recovery.